Howard, we're gonna draw some blood from you and we're gonna use that in our PRP process today. So we're gonna take about 22 milliliters of blood. This is what the tube looks like. It has some materials in there to activate those platelets and also to separate the white and red blood cells out so they won't be part of our procedure today.
What's PRP stand for?
Platelet-rich plasma. So just to prove it is red blood going in. We'll see what it looks like when it comes out. So here's your PRP. All right, Howard, so today we're still gonna work on fine lines and wrinkles and all of that. You have some scarring in the center of your cheek there. So we do some injection there. Any other things I should know about today as far as, you know, areas of concern?
Oh, I like my forehead line.
Yeah.
That's about it.
Okay, so we're gonna start just sort of doing your cheek first and then we'll move from there. You ready?
I'm ready.
All right. I'm gonna tap on a different area of your face just to sort of tell your brain you're not really feeling this. And for people who are viewing at first, you're gonna see sort of a bleb, but that's actually gonna dissipate. And by the time I move on to the next section of Howard's face, that little bleb there will actually be gone and it'll be sort of absorbed by the body. So it's a pretty amazing thing. And each time I inject, I'm actually causing a small amount of an injury, which sort of tells the platelets to come alive and start repairing and doing what they do best, which is regrow new cells. And those new cells make new tissues. And those new tissues are collagen, elastin, and fat, which bring youthfulness and repair any damage. We're gonna now, under his eye, we're gonna do some injection, and it really restores the fat to that area and sort of takes away any of the tendency to have dark areas or bags, puffiness, that kind of thing. So there's not a lot of injection that we do in the forehead generally, but because he has a bit of a scar here and we'd like to see that go away and he doesn't care for the lines in his forehead, I do just do a few little injections in that area and then we'll go ahead and microneedle it. Microneedling basically causes microchannels in the skin, and when you cause that microchannel, we're going to actually smear PRP on the top of that, and the purpose for that is more of a surface collagen elastin building. It's not going as deep as I did with the injections, but it's really going to work on more of the surface hyperpigmentation, fine lines and wrinkles, the same, all of it basically rebuilding cells that rebuild structures like collagen, elastin, and fat in the skin. So, you doing okay?
Absolutely.
All right.
Feels like I'm shaving.
Just gonna go a little bit more shallow around the eye area. It's a thinner skin, so it doesn't need to go that deep. Howard, have you had much bruising when you've had this done?
No, not at all. In fact, I've gotten out in public and...
How soon are you able to go in the public without feeling uncomfortable?
Oh, it just looks like a sunburn.
Okay. And so microneedling really is what causes that sunburn appearance, but when we add the PRP on top, it really starts that healing process right away, and so you don't have as much of that sunburn. How was that? Not too bad?
No, not at all.
All right.